Yeah, well, Mecklenburg, Watauga, and Lancaster counties, they are the ones that are going down, if even a slight amount. But there are other areas, other counties in our viewing area specifically, that are still continuing to see that skyrocketing case amount. It may sound like a broken record, but the more it's being said, the more it just seems to be getting worse. COVID cases reaching new peaks and hospitalizations, and in some counties, it feels like everyone is getting it.
We didn't have to get to this place. We didn't have to get to a place where, it is very hard to find someone who hasn't had COVID-19 at this point.
Alyssa Harris is the Rowan County Health Director. She did not mince words on how bad things are right now.
It is so incredibly important that we take a step back as a community, as a society, to say, hey, we do not have to have the spread of disease where it is right now.
Rowan is one of a handful of counties now seeing something that hasn't been seen in the last 2 years, specifically CDC numbers showing 7-day positivity rates above 40%. Iredell, Gaston, and Union are also on that list. Burke County is not on that list, but they face another issue.
People were having to wait longer periods of time for their test results.
The CDC says the county has a 32% positivity rate, but that's up more than 10% from what it was. And it's gone up so much, they called in the state to help with testing.
We asked the state for assistance to come in. It was kind of seeking out for help before it became a problem.
Right now, health officials recognize they are in a weird spot. Vaccination rates are still below the state average, and many of the counties seeing the highest positivity rates. And want people to get vaccinated, health officials know at this point it's going to take more than that, and people need to hear it from those they trust.
Once you've had that experience, please share your story because that story can help save someone else's life or prevent them from getting severely ill or prevent them from spreading it to someone who can become severely ill. And I think explaining that chain of reactions that happens after someone has been positive and how we can prevent that is so important.
And those numbers do mean real cases, hospitalizations, and in some cases, even real deaths. And the potential for overcrowding the hospitals, which is part of the reason we had some of the lockdowns we did anyway, right at the beginning of the pandemic. Also, it's important to remember here in Mecklenburg County, we still have the mask mandate. And for that to go away, we have to be below 5% for about 7 days, or at least on a 7-day positivity average. At this point, we're at 33% here in Mecklenburg County, and we are nowhere near that 5% mark, at least just yet. And at this point, it's going to take a while before that comes down. We're live in Uptown. Derek Dellinger, Queen City News.